June is Migraine and Headache Awareness Month, and we all know the impact that seasonal triggers of chronic migraines can have. Joining us is neurologist Dr. Jennifer Williams McVig and Good Housekeeping's Lori Jennings with must-have information about chronic migraines that you may want to consider this summer. Good morning, ladies. How are you?
Good morning.
Good morning.
So I must say, I am one of those that suffer. So this is like right up my alley. So first, though, it's interesting partnership. Why did housekeeping want to focus on chronic migraines this summer? Let's talk about how the relationship happened.
Well, Good Housekeeping obviously has been speaking to women for 130 years, and today our audience is about 40 million strong across the country, women, and women are the ones who suffer from chronic conditions, much more so than men. And we found that people were writing to us often asking for advice and asking for tips. How can I deal with this pain? How can I address this, that, the other thing? And migraine kept coming up as a thing that women were facing. I mean, I think the stat is women are 3 times as likely as men to suffer. And it just became clear to us that we had the power to share this important information and help people live more normal lives. So that's why we partnered with Allergan. We partnered with Dr. McVig today to get some of that key information out into the world.
Well, Dr. McVig, we want to get you involved here. The chronic migraine, what definitely gives the chronic migraine its term? I have migraines once in a while, but when do you define chronic?
Okay. That's a great question. And as a headache specialist, and I too suffer from migraines and headaches. So I'm happy to partner with Allergan and with Dent Neurologic, where I work here today. Chronic migraine is a headache that happens 15 or more days out of the month. So almost every other day. And most people will say that they struggle with a headache more than the 15 headache days. A lot of patients, if I ask them how many headache days that they are a month, they'll say 5 or 6. But then I say, how many days are you headache free? You have no headache. And then the answer is very different. They'll say, well, I have a headache almost every day. But there's just some bad ones that are debilitating. So the definition also is that there's about 8 debilitating days where there's light and sound sensitivity. You can have nausea, sometimes vomiting, and a throbbing sensation. And many people misinterpret it as a sinus headache, but 98% of the time this is not a sinus headache, it's actually a migraine.
I'm so glad you say this, because I literally have this debate when I feel a headache coming on. Is it either a migraine or is it sinus? This time of year in Florida, I feel like so many of us are triggered by those seasonal allergies. How do you know the difference between the two? Can one turn into the other?
Yes, one can definitely turn into another, and especially if there is sinus. Sinus, usually there's a fever, there's nasal discharge, whereas migraine is more that, like I said, light sensitivity, sound sensitivity, throbbing sensation. You can be triggered, like you said, by the environment, by pressure changes, weather changes, things that you might do to yourself, like not having enough water, not getting enough sleep, stress, things that you eat like caffeine, cheese, chocolate. But overall, that can eventually turn into the migrainous headache that we talked about that's very debilitating.
I'm so glad we're touching about this, but of course it's good to identify the problem, but it's even more important to talk about treatment options. What are we seeing out there?
Absolutely. Well, in terms of treatment, I mean, I think before you even get that treatment, it's really smart for people to record their symptoms. So keep a diary, write down what you eat, write down how well you sleep, what your stress level is if you can, and then the severity of your headache, so that when you go to seek out that treatment from your pain specialist, your headache specialist, you have a real tool that the doctor can use to help diagnose that. And then I'm sure, like Dr. McVig, the doctor will share one key preventative treatment, which is FDA approved since 2010, and that is Botox. And I think the doctor should share a little bit more about how she does that in her office, because it's pretty amazing.
So oftentimes patients will come, and like we said about the sinus, they're misinterpreting what their pain cues are, and they're using over-the-counter medications to treat their headaches, and repetitively using these medicines, which can be dangerous if you use them more than 3 days out of the week. You want to prevent the headache. We want to be pain-free as individuals. This is a disease state. Migraine is actually a disease. It is not just a headache. You know, it can be very debilitating. So by using a preventative medication, and Botox is the first FDA-approved headache medication. It's been out there since 2010. We have a great deal of experience with this medication. As with any medication, there can be some side effects, such as if you have difficulty swallowing, you should tell your healthcare provider. But if you feel like you have these symptoms, contact a neurologist or pain management specialist. Or there's a website that is BotoxChronicMigraine.com. That's BotoxChronicMigraine.com that can give you more information about this, and you can find a provider in your area that might be able to help you.
Good stuff on that, ladies. We have to leave you for the day. Thank you so much for this crucial information.
Thank you so much.
Thank you.